As we reach to the third day of the Congress TV streaming, we had a very distinguished guest by our side, Mr. Jose Lopez from the University of Washington and Bloodworks Northwest from Seattle, right?
Correct.
Yeah. Welcome.
Thank you.
Today, you made a presentation at the TSH AHA session.
Mm-hmm.
Could you give us a brief information about that presentation?
So what I talked about was work that we're doing on a very rare disease called thrombotic thrombocytopenic purpura, or TTP for short. Of course, you don't want to say that all the time. And we have been working on the mechanisms that cause this disease. It's a rare disease, but it's a deadly disease. And the treatment is quite complicated, and that involves plasma exchange, where you take out the patient's plasma and you put back normal plasma. But that requires that you have specialized equipment and you have to put people in the hospital. And what we have done is that we have tried to use a rather inexpensive drug called N-acetylcysteine at high doses intravenously to treat the disorder. I don't know yet, I can't tell you whether it actually works, but we've studied a couple of patients very intensively with many laboratory tests and have found that, well, both of these patients that we tried got better very fast, which could have been because of our treatment or it could have been just incidental. But they both got better very fast. And the findings that we had were quite surprising. And one of them was that these patients are under extreme oxidative stress. Oxidative stress being that when products of oxygen attack the body, its molecules, its cells, etc. And the drug that we give actually works as an antioxidant, and people know antioxidants because they're always being advertised on television, on radio for being healthy. Mm-hmm. The drug that we gave was in very high doses as an antioxidant, and we had some very interesting findings.
How long have you been working on the subject?
I've been working on this subject my entire medical career almost. When I was a medical resident, I encountered a patient with TTP. And that patient was extremely interesting to me. I diagnosed her, and because of that, I was asked to give a talk about it. And it made me very interested. In this disorder, what happens is that blood platelets they plug up small vessels all over the body, and that's how the disorder kills people. And it was very interesting and fascinating to me that this happened, and we didn't know how it happened then. But since that time, I had been working on the basic mechanisms by which platelets can attach to blood vessels and how they make plugs and how they cause this disease. So I've been working on it a long, long time. And I was reading about something else, disorders of the lung, like cystic fibrosis, where they use a drug, this drug that I talked about, N-acetylcysteine, to break up these big mucus molecules. The protein that the platelets stick to in TTP is called von Willebrand factor, and it is formed very much like the mucus molecules. And so the idea was that this drug would work in TTP the way it works in cystic fibrosis. And so far, it looks very promising.
And how was your interest in hematology begin?
Well, that's where it started with that patient. So I was asked to give a talk about that patient because at the time I was in a small town in Montana, where I was sent as a resident to work, and they didn't know this disease, so they asked me to talk about it. So I had to learn all about it, and that's where I became very interested in platelets and platelet function and diseases that are associated with platelets. Other diseases that platelets are involved in, if you don't have enough platelets, it's bleeding. If there are too many or they work too well, is blood clots, like heart attack and stroke.
And did you have any collaborative works with Turkish hematologists before past about on this subject or else?
Well, on this, yes, on these and other subjects, in particular on In Turkey, there are, it's a very good place to study certain genetic diseases. And I have worked with Turkish hematologists, especially on Dr. Reyhan Dizküçükaya, on studying some of those patients, and also on studying genetic factors involved in how platelets react, and genetic factors involved in people's risk for heart attacks and strokes.
Our participants will be watching this streaming, and do you have any advice or any anything you want to say to them?
Well, I guess
for last.
Well, I try to encourage doctors. I mean, this I don't want to preach, but I like to encourage doctors that when they see their patients, that they always think about, why is this patient sick? What is causing this illness? That's, I guess, doctors thinking like scientists in a way, that to be curious and to study them, so that the more you study the patient, the better it is for the patients in the long run, because you will understand what is happening in the disease, and you'll be able to treat it better in the future. And I think that for many rare diseases, I think that Turkish physicians have a really good opportunity to study many of them, because they get to see a lot of them, and can really contribute to the science and treatment worldwide of these patients.
Thank you so much.
Thank you.